Welcome back to NewsX. Our top focus continues to be the HMPV. 3 cases of HMPV have been detected, 2 from Karnataka and 1 from Gujarat so far in India. This respiratory virus is reportedly spreading like COVID-19 through touch and contact with contaminated objects. Common symptoms include cough, fever, nasal congestion, sore throat and shortness of breath. But meanwhile, the Center for Disease Control and Prevention says that severe cases can lead to pneumonia, bronchitis and white lung syndrome. Reports indicate that the incubation period ranges between 3 to 6 days depending on the severity of the case. This virus circulates in distinct annual seasons. It starts in winters and can last till spring. As of now, no specific antiviral therapy or vaccine is available for this virus. However, we will now take the next 20 to 25 minutes to really discuss point by point, question by question with our guests who join us on the broadcast as well. I see Dr. PSV Rao is with me. Dr. PSV Rao, of course, there is a lot of now some panic and confusion and chaos simply because lots of reports continue to pour in from China, where it is said that the hospitals are a little bit overflowing with patients complaining of the HMPV. But I want to just take our viewers through very specific questions and then request your help in further explaining some of those FAQs. We also have with us Dr. Sanjeev Bagai. Hopefully, I will get a list of all the guests with us shortly. Question number 1, of course, is what are the symptoms of the HMPV? What we have understood is that normal symptoms are similar to a flu, cough, fever, sore throat, headache, fatigue and shortness of breath. But Dr. PSV Rao, if you can take our viewers through this particular point, what really are the symptoms of HMPV, sir?
Good evening, Devika and all the viewers. The symptoms are not any different from an influenza virus, flu, or any of these adenovirus, rhinovirus. There is a whole host of respiratory viruses which will cause similar symptoms. And this is why I want to assure people who are watching this program that this HMPV that has been discovered today, now the count has gone up to 6 and it will keep going up, is simply because there is a surveillance going on. People are being checked. See, here in Karnataka, and I'm sure this is in the rest of the country, we have a respiratory a set of tests for respiratory viruses, and this set of tests has 22 respiratory viruses being tested for. Now, it costs 8,000 rupees and doesn't make any sense to catch anyone and everyone who is having a respiratory infection and start testing this for all these things. But as a matter of surveillance, it was the ICMR has now started checking out to see what is the viruses which are presently in circulation in India. And HMPV is one of those many viruses in circulation. Symptoms are similar to everything else.
Okay. All right. Coming to question number 2. Is the HMPV an existing virus or is there a new variant? What we have learnt is that there is no widely reported new variant of HMPV, but it does have the ability to mutate over time, leading to newer strains. I want to bring in Dr. Sanjeev Bagai on this as well. Dr. Bagai, if you can perhaps share your thoughts on the same. What is it that the doctors community has learned so far about the cases that we see right now?
Good evening. There is no need to panic and there should be no undue stress. This virus has been in circulation worldwide for the last 25 years or more. In India, it has also been there earlier than this outbreak in China. In fact, meta-analysis data show that there have been similar outbreaks in Vietnam. And there is a 10-year data which has been published from 2003 to 2013. And likewise, a 5-year data from 2013 to 2018 in China itself in one of the districts. This virus has not mutated much over the past few decades. And the reason is that although it has the major proteins, the 9 major proteins, but it doesn't have the NSPs, the non-specific proteins. It doesn't also have the spike protein, which is the dreaded one in COVID. So it's much different. It is milder in presentation. The general thing is cold, cough, fever, wheezing, occasionally breathlessness, very rarely bronchitis and pneumonia. It involves children basically in the age group of 6 months to 12 months. It is a lesser incidence than even respiratory syncytial virus, the most common virus in early infancy. And it's not as dreaded. The case fatality rate is very low worldwide. The virus, like I said, is not mutated. It is of two subtypes, subtype A and B, and A itself is of two types and B itself is of two subtypes. But having said that, the B1 has more incidence of wheezing. The subgroup A doesn't have so much amount of wheezing. It is not mutated. The genomic code has been in existence for the last 2.5 decades. Really, the presentation is very much like any other viral illness. And the carry home message is if you have cold and cough, don't self medicate. Take your advice from your local doctor. Look out for early signs like breathlessness or poor feeding in children. Look out for fever. Don't take irrational antibiotics at home. Keep the child home in case the child has a cold and cough. And again, it re-emerges the concept of masking. Masking is still important. It will help us in winter for a host of viral infections, not only the metavirus, but a host of viral infections. But no need to panic whatsoever.
Now back into the broadcast. Dr. PSV Rao, our third question that we'd like to ask you is who is most at risk of getting the HMPV? What we have understood is younger children under the age of 2 are most vulnerable, as well as older adults above the age of 65 or people with weak immune systems and other vulnerabilities are more prone towards picking up this particular virus. But if you can shed some light on who is most at risk, sir.
You have already mentioned who are the people are at more risk. I'll explain why. Now, the HMPV virus is considered quite common, I mean, existing everywhere. And it is believed that by the time you are 5 years old, you would have been exposed to this virus, your immune system would have recognized it, and your immune system will be strong enough and activated enough to prevent any further infection with this. This is why we see it so much in children, and this is the same thing which is said about some of the other viruses like the respiratory syncytial virus, which sees in children. Now, when you grow old, or when you have comorbid conditions like diabetes, or you're on steroids, or you have had a chemotherapy for cancer, or you have been immunosuppressed because you have had a transplant, what happens is your immune system is weakened, and hence it is unable to fight the virus. This is why you see it in these, not only this virus, various other infections also are more common, and also in conditions like AIDS, etc., where there is immunocompromise. Immunity is our security system. If your security system, one, as a kid, is not yet fully developed, or it is unable to recognize the virus, then you are in trouble. Or when your security is weakened, then you will be in trouble. And why COVID was very different from all these infections was because it was a totally new identity where the spike protein and some other features had been obviously inserted into a coronavirus which didn't exist in any other coronavirus, making it far more infective to human beings and far more deadly. So this is why right from the beginning, fingers were pointed that this was a bioengineered by gain of function research, and this was not a natural mutated virus. Now all these viruses will mutate, especially the RNA viruses, and try to survive because they know that the immune systems are getting smarter and smarter. Vaccines are being developed. So they, to survive, they keep mutating and changing. So when they change their identity, initially our immune system is unable to identify them. And once they are able to identify them, they will. So it is important that we take all precautions. Things like masking, avoiding crowds, and keeping hand hygiene, etc., helps us against all viruses. Now, there are so many respiratory viruses that you can't be vaccinating against all of them. We have influenza vaccine, we have the pneumococcal vaccine, but we don't have vaccines on everything, and we can't be vaccinating everyone for these numerous viruses which cause respiratory infection. We can only take precautions and prevention is always better than cure.
Okay.
And
all right.
Thank you.
Okay. Dr. Sanjeev Bagai, bring you back into the conversation, sir. Another question that we've posed, question number 5 is, when and how should one test themselves for the HMPV?
I think there is a respiratory panel which is available. It's a RT-PCR test. We normally get it done if the child has a severe attack. Normally, the viral infections are extremely mild. Routinely in an outpatient clinic, we don't even test clinically for every child coming in with cold and cough. We go more clinically. But if a child's presentation is with acute onset wheezing, very high grade fever, rashes, if the child is breathless, yes, definitely a respiratory panel should be done, which should include screening for RSV, influenza, parainfluenza, and indeed now HPV, human metapneumovirus. The treatment really is just symptomatic. It's fever relief with paracetamol, good hydration, adequate feeding, looking after the nutrition, and giving adequate rest to the child. No antibiotics are required, no antivirals are required, and at the present moment, there is no vaccine which is readily available. We go more clinically. A host of viral infections, more than 8 or 9 common viral infections infect the children in the younger age group. And over a period of time, human beings as children, when they become little older and adolescent, develop natural immunity towards these viral infections. So again, the stress is to go clinically, not to over-medicate, not to over-investigate, but keep a high index of suspicion. If there is a suspicion, early diagnosis, isolate the child at home, don't self-medicate, inform your local doctor.
Okay, all right. The question number 6 that we've thought of, I'll bring Dr. PSV Rao back into the conversation. Dr. Rao, how long does the HMPV test result really take? We know that there's a quick antigen test that is available, which gives the results within 15 to 30 minutes, which is what we had also done during COVID. But the actual result could take several days or even a week.
Yes. See, there is a difference between trying to find out through a antigen antibody reaction or a quick reaction as to if you have been exposed to that virus or having. But actually identifying the virus and getting his genomic sequence, etc., takes a long time, and that facility can't be provided anywhere and everywhere. When COVID started, we had to send all these samples to the Institute of Virology in Pune to get it all done. Later on, temporarily, this facility was also provided here in Bangalore. But what we are doing now, which is available, but we are not doing it on every case, is like what I said earlier, covers 22 viruses. There's a whole list of respiratory viruses, which includes 4 different types of influenza virus, the HMPV virus, and rhino adenovirus, and coronavirus, and a whole lot of other viruses. There's no point reading out this whole list. I don't want to frighten people. It's just that we don't find the necessity to do it because all their symptoms are alike, their treatment is alike, and most of them are very mild, and nothing much happens. Once you're and the children easily recover, and most people recover. But we would say, why do you want to risk getting infected? Please take precautions so that you don't get infected in the first place. And crowding hospitals out of fear will only lead to further spread of infection. So don't crowd the hospitals, don't panic, just keep calm and stay away from the infection by not going to crowded places and by using the N95 mask. And these infants obviously didn't go anywhere. These infants who have shown the infection must have been brought to them at home by people in the family. So if the adults take precaution, hopefully the kids will also be safe.
Okay, all right. Dr. Bagai, bringing you back into the conversation with question number 7. What we want to understand is, under what circumstances should one then really quarantine themselves? Is that even required?
Routinely, no. So a viral infection normally is most of the time, 80-90% of the time, not only in small children, infants or teenagers and adults, it is subclinical. So you may have just a little bit of body ache, maybe just a little bit of a sore throat, and it's life as usual. Normally people are advised to stay at home. If you have bouts of intense cough, sneezing, painful swallowing, that is a sore throat, or indeed you have a cough. Breathlessness in children is extremely important to watch out for. If you have symptoms like this, definitely for a period of 4 to 5 days, you should stay at home. The incubation period, like you mentioned, is 2 to 6 days, but the infection itself plateaus off between 3 and 5 days. So, an isolation at home is only required if you are truly symptomatic. Again, you need to go to the local doctor. Let the child, especially the children, be clinically examined. A telephonic conversation or a video call in these kind of cases, especially for small children, is not advisable. If you are bringing a child out, make sure even children have a pediatric size mask. Adults must mask themselves because they can indeed be carriers bringing this infection at home and exposing less during the winter time and the pollution, especially in northern India.
Okay, so stay on with us. One more question. Question number 8. What can you really do to prevent the spread of the virus, or is there anything that one can do to simply not catch it or just improve their immunity perhaps? That would be a better question.
Is that for me?
Yes, sir.
Yeah, so prevention is always important. Hand washing, personal hygiene, masking, keeping safe distance. Remember that this is a respiratory infection. It is carried as a microaerosol. It can travel more than 6 feet. We've learned through COVID that these microaerosols can travel to a distance of over 60 feet. It can remain suspended in the air in a closed environment for hours in spite of the index person who's carrying the infection having left the room. We know that the virus does not have the NSPs, the non-specific proteins, so therefore the mutation rate is a lot lower than COVID. But all the same, this has been in existence and it can infect children because the immunity system is that much lower. The other simple precaution is hydrating themselves well, keeping good nutrition. Nutrition is the key towards immunity, and making sure and looking out for early symptoms. Mother knows best. Always the mother knows the symptoms of a child, whether the child is feeding well, if the child is breathless, or if the child is listless. These are critical symptoms which the mother will be able to point out to the doctor.
Okay. One of the last questions Dr. P.S.V. Rao posed to you is, what really then is the treatment of HMPV? We've already learned that one of the infants who became the first cases in India has been discharged from the hospital. Another infant in Karnataka is under observation but likely to be discharged soon. But in the case in Gujarat, we were told that the infant was actually kept on ventilator for 5 days. So there is of course a difference in severity and how infants are also responding to it. But what essentially is the treatment, sir?
Dr. Bhagai has already answered that question. It is about hydration, about giving good nutrition and keeping a close watch on any deterioration in the symptoms. So virtually all the cases will recover by themselves and won't need anything very specific. There is no need to panic and start trying various antiviral and antibacterial medications. Now, as far as the Gujarat patient is concerned, obviously there may have been some delay, there may have been something more severe, or that variant would have been worse, and the environment of that child would have also been somewhat different from the here, especially in the north where it is much colder, much drier. You will have far more problems, and hence the importance of prevention. And if you prevention is always better than cure. And if you can't, if you don't have, if it has not been prevented, you have the infection, then these are the things. And it is very rare for any of these infections to land on a ventilator or need such major problems or develop pneumonia and bronchiolitis, or if they have an asthmatic problem, for the asthma will get exacerbated. So ventilator is very rarely required.
Okay, all right. I request both our guests to stay on with us. I'm going to quickly read out the statement that has been made by the Union Health Minister. The Health Minister has clarified that HMPV is not a new virus. It was first identified in 2001 and it has been circulating in the entire world since many years. I will really request our team to please make sure that we can play out that soundbite of the Union Health Minister as well. But let me quickly read out what is it that we've received. He says HMPV spreads through the air by way of respiration. This can affect persons of all age groups. The virus spreads more during the winter and the early spring months. On recent reports, the cases of HMPV in China, the Health Ministry, the ICMR and the National Center for Disease Control are keeping a close watch on the situation in China as well as in other neighboring countries. WHO has taken cognizance of the situation and will share its report shortly with us. The country data for respiratory viruses available with ICMR and the Integrated Disease Surveillance Program has also been reviewed, and no surge in any common respiratory viral pathogens is observed in India. The joint monitoring group meeting was held under the chairmanship of Director General for Health Services on 4th January to review the situation, and he says, of course, remain vigilant, ensure that the country will respond promptly. Do we have the soundbite finally? Okay, let's quickly listen into the Health Minister, please.
Health experts have clarified that HMPV virus is not a new virus. It was first identified in 2001 and it has been circulating in the entire world since many years. HMPV spreads through the air by way of respiration. This can affect persons of all age groups. The virus spreads more during the winter and the early spring months. On recent reports, the cases of HMPV in China, the Health Ministry, the Indian Council for Medical Research and the National Center for Disease Control are keeping a close watch on the situation in China as well as in the neighboring countries. WHO has taken cognizance of the situation and will share their report shortly with us. The country data for respiratory viruses available with Indian Council for Medical Research, ICMR, and the Integrated Disease Surveillance Program has also been reviewed, and no surge in any of the common respiratory viral pathogens is observed in India.
Okay, all right. So there we've heard the Health Minister as well. On that note, I thank both of our guests, our doctors, for joining us on the broadcast to really just break down and reassuring the public at large that yes, we must remain clean, we must remain vigilant, but there is really no need to panic. On that note, a very short break.